introducing Sara for healthcare, revolutionizing digital health and bringing back the joy of care with AI. Love it. So the team that's presenting is there's Rizwan, the Chief Digital Officer at Pure Health. Then there's Akhtar and Pankaj from Innovation. So stage is yours, guys.
Well, thank you very much for coming out for this session. The Innovation team was kind enough to ask me to just do a little bit of context setting before they take it away in terms of the product showcase. My name is Rizwan Tufel. I'm the Group Chief Data Officer for Pure Health on the journey of healthcare modernization and innovation in the region. For those of you who don't know, Pure Health, we're the largest integrated healthcare network in the Middle East, 25 plus hospitals, an insurance company, and a number of other allied assets. And we're deeply familiar with the challenge, the opportunity, and the excitement around AI in modernizing healthcare. We're also painfully aware of the things that hold us back. And the things that hold us back are number one, a data deficit. And what that means is this lack of confidence in the quality of the data that holds us back and says, are we really ready? The second is the skills gap. The skills gap of clinicians who are comfortable with technology. And the third is the fear factor. You and I, as well as physicians, are beginning to hear about AI, but it's something that they're just beginning to experiment with. And that holds us back. About the technology that they will showcase right now is that it addresses all three of those problems. Number one, by using technology in the capture of the data at the source, it actually helps build up the quality of the data on which decisions will be made. Secondly, by putting this technology right as part of the patient experience, it builds that level of confidence in both us as individuals as well as the clinician in the technology. And thirdly, it helps overcome that skills gap by becoming an assistant, a helper to the clinicians. So I'm really excited about the technologies that, the set of technologies that the Innovation team has developed and showed me, and that they will talk about in detail during this session. So I will hand it over to Pankaj to start off the session.
Thanks, Rizwan. Thank you so much for your practical and right. Hi everyone, good afternoon. Thank you so much for joining us. Today we are going to embark on a journey into the world of healthcare. Specifically, we are going to talk about AI in healthcare. And today we are going to talk about how AI has the potential to solve some of the most pressing challenges of healthcare. But before that, let me introduce Innovation very briefly to all of you. Innovation is a native healthcare company. We have a unique set of capabilities that offer solutions that impact cost and quality of healthcare. We have honed and automated these solutions over several years. Today, we have our solutions installed at 90 plus enterprise client sites across 1600 care settings, and we are custodian of 55 million plus patient lives. Talking about the problem that a lot of organizations, a lot of healthcare organizations were facing in the past, they were faced with the choice to get a good healthcare data platform with subpar point solutions, or they were forced to choose good point solutions with subpar platform, right? And humble to share that we have solved that problem. We offer industry leading class number 1 rated healthcare data platform with best of breed solutions. Happy to have friends like Mubadala, RDO, QIA, to fuel this rocket ship for us. Uh, and we have been asked this a lot of times. Are we secure? Are we compliant? So, want to put this front and center that our data activation platform, our solution, have been scored 100 out of 100 by Security Scorecard, a rating agency that goes through a number of measures to rank the security of a vendor solution. And we're gonna now talk about our solution suite. So I'm gonna start at the bottom of the picture. At the bottom of the page, we have our systems of record. This is where we ingest data from a number of sources, be it clinical, non-clinical, digital, genomics. Our data activation platform is capable of ingesting the data, massage it, transform it, and convert it into a single source of truth. Once the single source of truth that we call Patient 360 is installed, on top of it, we have our system of intelligence. This is where we activate the data, right? This is where we provide insights to all the stakeholders, ranging from something as simple as descriptive to all the way prescriptive. On top of our system of intelligence, we have our system of engagement. This system of engagement is our full suite of applications and workflow that cater to all the stakeholders in the healthcare continuum. So we have solutions for analytics, we have solutions for engagement, both physician and patients. We have solutions for care managers, for CRM teams, for researchers. And now we have introduced artificial intelligence to power this solution even further. So we are going to talk about this in the due course of time, but I want to touch base on the 4 use cases that we have live. The first one is Sara for Insights. This is where we enable teams to access predictive insights. We have our Sara for point of care, and we are going to demo this today. The solution is using AI to free up physicians, doctors' time. We have Sara for care managers, which is again automated a lot of tasks that should not be taking a lot of time from care managers. And last is our Sara for Experience Center, where we're bringing the power of technology to update care, marketing teams and CRM teams. Now I will invite Akhtar to sort of take you through the AI journey.
Thanks, Pankaj, and hi everyone. It's a pleasure to be here. I think Pankaj in the previous slide gave you a good context in terms of how we are using our platform to drive various outcomes. I want to focus a bit more on the value side of it. When we talk about the healthcare continuum, there are 3 broader pillars to it. The first one is the organization that we are working for. The second is the patient that's at center of the healthcare. And the third is the productivity pillar that how are we increasing and optimizing productivity. Using the same landscape, when we talk about the first one is the value landscape, that how we are adding value to the organization that we are working with in terms of reducing the cost of care and making care affordable, and at the same point of time making it accessible for patients. The second one is the pillar that revolves around the patient, because patient is at center of all of this journey. Whatever we are doing, that is there to make sure that our patients receive a better care. So we have our experience suite that enables us to make sure that care is accessible to patient and the journey is easy and seamless. For both these pillars, the most important thing is productivity. What we have seen that there is a huge burnout for care providers, for physicians, for care coordinators. With the advancement of the technology, the focus was more towards that, hey, can we reduce that burnout? Can we make sure that, hey, care is available to everyone while making sure we allow all physicians for the better utilization of the time? That's the reason we also call it joy of care. We use the concept that physicians, their hands were for to do something else, not for typing. How can we enable that physicians have to type very less when they are talking to the patient? And for that, we are unveiling our third suite, which is productivity, which includes the 4 solutions in it, which covers multiple persona of caregivers. Sara for Insights, which will be mostly used by the business analyst and the care coordination team. Similarly, Sara for Care Management, which will be used for case management, disease management. Sara for Point of Care, which has been specifically devised for physicians and practice at staff. And the Sara for the Experience Center that covers the patient portfolio and how patients engage with the experience centers. AI is a buzzword in town, and everybody is talking about AI. But there are a few basic questions that we need to ask ourselves when we talk about AI. The first one is the data accurate? And thanks to Rizwan for kind of highlighting the importance of data, the quality of data in building a good AI solution. Because if AI is not giving you the right outcome, then it loses its essence. So the accuracy of the data is the first question that we need to ask ourselves that, hey, is my data accurate enough so that it can give me the right outcome? The second one is the security of data, which is the most critical part because healthcare data is the most sensitive. And it's for organization to determine that, hey, in what capacity their data is being used. Is it used to kind of share with third parties? Is it used to kind of drive another and train another models? Or is it used for only the purpose what it is intended for? So security becomes an important factor. And the third part is the compliance. Compliance with the region where it's being adopted and compliance with the organization for which it's being adopted so that we follow all the three practices. Now, let's meet Sara and we say that it's a responsible AI. Responsible AI for the reason was it caters to most of the questions that I had in the previous slide, making sure that it's secure, it's reliant, and it's compliant as well. Now, how Sara is enabled to do this job, we have more than 2,000 health concepts in the system that the model has been contextualized specifically from the healthcare. If we talk about most of the AI solutions in market, be it ChatGPT, be it Bard or others, those might give you a good output for a particular use case. But when you test that on the larger volumes of data, it doesn't give the right output because the probability of the code hallucination is very high. What we have done is we have contextualized Sara specifically for the healthcare. It understands the healthcare terminology. It understands the context of conversation what the end user is trying to achieve and then gives you the output that enables us to make sure that hey, when a patient-physician conversation is taking place, it contextualizes properly. It understands, hey, can there be a correlation between two diseases and bring those insights to physician. The third one, in terms of the formulas that we have built, the logics that we have built to train this, we have 800 plus formulas in the system that has trained this model. Perfect. When we talk again, going back to the responsible AI, the intent is to build transparency, build reliability, and build trust. And that I can explain in the 5 key levers. The first one is reliable, which kind of directly ties with the accuracy. That hey, are my answers accurate? Am I getting the right output? Second is the accuracy of the data in terms of how the models are trained, what's the output I am getting. The third one is the data security, how my models are used, how they are trained, is it in a secure environment and whatnot. The fourth one is the efficiency. Because when we talk about AI, it can be used for the larger purposes, but at the end of the day, all those kind of convolute towards running an efficient model and making sure we are optimizing on our current goals. So that brings efficiency. And the last one that we are covering is seamless integration. If we have an AI solution that's not able to kind of integrate seamlessly with other solutions in the market, it loses its essence. We don't want to spend months to integrate AI solution with other solutions in the market that we're using. So making sure that the AI solution seamlessly integrates with your already invested network, that is very critical, and we have covered that milestone. Now, I stress a lot on accuracy and I want to highlight this point. The Innovator AI solution, Sara, is 15 more accurate than ChatGPT 4, which is the most used generic AI solution in the market. The reason for that is we have more than 8,000 English queries while we have trained from. It understands the complexity of the language. It understands what's the context in terms of healthcare. For a particular one occasion, ChatGPT might give you a better output. You might say, oh yeah, it's telling me all the context. But when you contextualize that whole ecosystem where you have hundreds and thousands of patient data coming in, there is very high probability of ChatGPT hallucinating and giving you a very generic outcome. And that's what we have tried to kind of control in our solution. It contextualizes it based on the previous records. It gives you only that information is critical. It won't recommend you general concepts in terms of hey, somebody is feeling cold and they need to go for blood count. I can show you examples where if I'm putting ChatGPT, generate me some soap codes for somebody having cold and fever, and the response might be like, oh yeah, they need to go for a blood testing. No. If you have fever and cold, you don't need to often go for the blood test. The first thing that you need to understand is there a probability of COVID as an example. So that's how we have named our Sara AI solution. Now, when we talk about Sara, it has offerings for everybody. We earlier spoke about the two main pillars that there is a provider side organization for which that we are working. The first one is this physician side, where Sara enables the end user to listen to the conversation between patient and the provider and recommends insights. So what's happening on the input itself over here, it will record the patient and the physician conversation. It will be a theme-led conversation, so please bear with us. Avoid getting bored with that, because the real flow starts after that, that here, whatever has been discussed between the patient and physician, how it generates differential diagnosis for that. Because we can have multiple scribes in the market that will record the conversation. But what it doesn't allow you is basically generate differential diagnosis on top of that and send those differential diagnosis and recommendation directly to the EMR system. So please, 2 to 3 minutes conversation that we want to showcase you what's happening with what physician and patient are discussing, and then we'll come to the floor around it.
All right. Hi, I'm Dr. Jones. What brings you in today?
Hi, Dr. Jones. Good morning. I've had this pain in my left knee that's been going on for the last 3 or 4 months, but it's gotten a bit worse. It only used to bug me while I was walking or running, but now it's also started to hurt when I'm at rest. So wanted to come and get that checked with you.
So as
Sure.
you can see, while the conversation is going on, the tool is kind of recording and also documenting what is happening, like what's the conversation between the patient and the physician. It doesn't need to be on the screen whole time. During the course of this conversation, if physician wants to kind of look in the other data of the patient, they can kind of minimize it. While as if you see on the top left hand corner, it's continuously recording the conversation. That physician and patient can kind of talk other things as well. Physician can have a look at the remaining of the data, and the tool will kind of listen the back in a very ambient manner. It won't interfere with the conversation. It doesn't need to be on the display the whole time and kind of hamper that day-to-day workflow. It will keep on recording.
Almost like every time my foot hits the ground, I get a sharp stabbing pain. But while I'm at rest, it feels a little more dull.
Now, how would you describe this pain from a scale of 1 to 10, where 10 is the worst pain you've ever had? How bad is this pain?
A 6.
Now, have you experienced this type of pain before?
I did have something similar a few years ago. I used to be a rower in undergrad, and I got some similar pains before. But with some stretching and some strengthening exercises, it kind of helped. But I didn't go to see anybody in for it at that point of time because it kind of went away after a little while.
And now, are you still rowing?
No. The only activity that I'm doing now is running.
Running, okay. And from when it started till now, in the last couple of weeks, has it changed dramatically? Is it affecting your activities of daily living?
A little bit, yes. Like even now, just walking, I can feel it. The pain's not as severe, but like I said, when I'm running or when I'm at rest, it has started to pain, and I'm starting to notice it daily.
Okay, so what I think might be going on is that you might have had an old knee injury and you might have exacerbated it right now. It could be a couple different things. What I'd like you to do is perhaps start some acetaminophen, 325 milligrams, take it 3 to 4 times a day. We'll have you come back in 3 weeks or so, and if things aren't getting better at that time, perhaps we can send you to physical therapy where they can recommend some additional exercises for you, and perhaps even consider a X-ray of your knee to make sure everything was okay. How does that sound?
So I think exercise is something that I can try and give me 2 and 3 weeks. Sounds good.
Great. All right. We'll see you in 3 weeks.
Again, I know listening to conversations is always difficult. I don't know how to do it face to face, but I'm not a physician and I got these wisdom terminology. So I have to use a recording. The moment it finished, you saw like on the right hand side, it displayed like, hey, Sara is generating notes. Just see what will, from here onwards, what will happen in it will generate like encounter note has been created automatically, and it gives you all the detailed soap notes of this experience. If you remember, there was a discussion around like, hey, what's my the pain scale was like on a scale of 6 to 10. It was 6. It was an old knee problem. Probably like some recommendations like hey, in terms of old knee. It kind of automatically records all of that and gives you differential diagnosis and recommendations like hey, what the actual problem could be, and but intent being that hey, it records all the conversation that's happening, like whether it was a pain discussion, whether it was anything related to any previous illness or any previous issues, that's also recorded. One thing that I want to highlight, it's just not on the UI. You have a clear API visibility on the backend, which we can showcase also that, hey, if I talk about like chief complaint, it was pain in the knee, what my current symptoms are, pain in the left knee, it worsens because of the physical activity, then what's the follow-up in 3 weeks. So all of that is recorded. It can be enabled on the system, and this allows us to directly send it to EMR. So most of that typing back on the EMR will be eliminated. We don't need it further because you have this API call which you can kind of send to EMR and it gets recorded. How does it kind of enable to convert natural language into machine language and allow you to basically run queries without learning any coding or without learning any SQL queries? We can showcase that separately. Thanks everyone.
Okay, thank you. Perfect.